All right, tonight I believe is what we're going to do tonight. It's something very, very important for most of us, and most of us have been working, and you can see that our guest speaker is in house, ready and ready for us. You're welcome, sir, for having you on board, and thank you for giving us your time today, and we really appreciate that. So, most of us, we all know my name remains Dr. Pompey. You all call me engineer too, but you can. This is a PCV knowledge sharing where we share knowledge, where we share ideas, and it's a free class where we'll be able to bring in students together. Let's talk about bring in different people from all walks of life just for us to gain one or two things. But today, we are bringing another very good speaker, a facilitator, someone in house, and an MD. And as you know, it's mostly about health. And we all know that health is wealth. But from the topic, how would the health drives your business? So it still boils down to health is wealth. A lot of us have been working from Monday to Friday. Even some of us that are into services that we work on throughout the whole year, like PCV. Yeah, we are open from Monday to Friday, yeah, to Sunday. That is how we roll, and that is how we do things. But sometimes we need to be very conscious, and we need to understand that we meant to check and health. The only thing we think about is we make the money and we want to walk and walk. Sometimes the body asks for things when you are not conscious of it. You need to be conscious of some things because this same body that you're using anyhow, the day he asks for it, you go nowhere. So why don't you give some percentage of your some of your time and the percentage for you to gain from it? I particularly, as you all know, I'm transmitting, I'm hosting this program all the way from US because I came. This is summertime, and I even came for trading. I came for a program. That is how I roll my thing. But when I started too, oh, I believe, oh, let me walk sometime. But when there's a structure, when there's a way you structure your business that you can go. Now I know I can do 3 months, 6 months, I'm good to go. I don't bother that because I know the business will still go on. So you need to plan your health because when this health, this same body that you're looking at, when they ask for it, you will give to them. And that same business you believe you can live for one day, you can live it for a whole year. So we need to be conscious of what we have in ourselves. What is the, do you sometimes I ask most, do you even check, do we check the status, do we even check, do we go for medication, do we go for checkups? A lot of us, like we all know, the African sense that I don't want to go for it because the more they tell you one of those things, you might feel bad and you don't, you will have it at the back of your mind that maybe something is going on, but you need to check your status, you need to check you need to go for checkups, and that is how you know your medical status. Without you going for that, you don't know what you're doing. Most of us, I can tell you, there's something that happened that I think I went to the hospital for a checkup and all that. The doctor friend was telling me that do you see that lady that left just now? I said yes. He said the husband is just a moving corpse. I said, what do you mean by that? He said because the BP that the guy had. So sometimes don't let us look at the business. Let us look at our health. That is why we're bringing our facilitator today to tell us and to see that when you do the right thing, you will be able to carry on with the job. And do we consider vacations? Do we consider time out? The best way you can handle your business is when you consider the health. The same thing goes with your employees. Most of us, even you, the CEO, that you don't even check your own. How will you even talk about the employees? You might not even think about the employees. But do you know that the more you don't talk about your employees, the more you don't even have the plan on ground. Maybe they have different programs. Maybe they have the HMOs and all that. the business will still not give you the optimal percentage that you need. They won't still act the way you're meant to. You won't get more production and productivity. So let's put these things together. But today we're not talking about we are talking how we can marry the health and the business and how they go hand in hand. It's something, it's not parallel. This one is not parallel. They work hand in hand. One must not be lower than the other. They must be at the same percentage. That is how you can get the maximum thing that you need. So, not to waste much of our time, and I think we have some people in now, so the other people will join us, and I will say at this time again, welcome to PCB training, PCB knowledge sharing, where we share ideas, we bring in guest speakers, facilitators, those that are that is their expertise. They will tell us things we need to know. Keep your questions. We are linked with the YouTube, the Instagram, and TikTok. So this program, our facilitator will be able to bring and he will be able to attend and ask. You can ask any question you feel you need to you want to ask. He's going to answer us, and the one that is related to my inside, I will. But I'm not a medical person. I can only tell you how I manage my own business, because most of us, you need to. Some people were asking me, "Oh, I love this topic, engineer. How have you been doing your own the medical, the HMOs, the medical standard? How do you do it for your employees?" And I will tell you the little I can, but we have an expert here to tell us what to measure, what to check, because it was when I got to all those things, and I now know that you can do the business and have some rest of mind. All boils down to structure. A lot of us don't have structure. That is why you can't do the business. You can't do without the business, and the business can't do without you. The more you have that thing in your business, you are going nowhere. I've done it for years. I have that thinking behind me too, that even when they go out to work, I'll still be having that mindset that they won't deliver it if I'm not there. But see, there's nothing like that. Since I started putting things together, organize my house, I don't need to be there. Now I'm in US. I came to US from how many weeks ago? Now the job is going on. I can decide to stay 3 months, 4 months, 6 months. I know the job will be done. So detach yourself, separate yourself from the business. Reason why some of us can't do without going to site or without doing you is because you have this myopic mindset that without me, the business will not go. And that is not business. That means the day anything happens, unforeseen things that happens, that means the business is over. But that is not business. There should be continuity. So you should start now. The same thing I did, and I can see that, oh, so I can even do without, if I don't go there, things goes on. So structure yourself while you have that rest of mind. And that is what we call business. Business without, so for you to structure that, come in with the health part. I'm saying why we're bringing our facilitator today, because we lost two, I lost two of my friends. They're doing well, the business is there, but so unfortunate that it didn't allow them to even know much of this business. And why? The BP. And that's all. The horn was horning down, and people were saying, what's wrong with this man? Well, the time they got there, we lost him. The other one was just an heart attack. That's it. So I'm now thinking, what is the point of us working every day without us checking those things? So let's bring an expert to tell us there's some little things that you can just check up. Now, I have some gadget at home that I can use on my own, that you don't need to go to the hospital. You know that maybe every 6 months, every 3 months, but we'll hear from them. He's going to tell us more. So send in your questions from our platforms. We'll get your questions. Let's talk about the business itself. How is related to your business. Thank you. So not to take much of our time, Mr. Yomi, we'll be having you on board now. We want you to introduce yourself, and we still appreciate you bringing you on board tonight. And I believe you're going to give us, we're going to learn more on what you're going to tell us today. Thank you very much. You now have the floor, sir.
Thank you, Dr. Pompey. My name is Abayomi Ogunderu. I believe everyone can hear me, right?
Yes, please.
It would be nice for people to come on video so that we all can see ourselves.
All right. Can we all just use the
Yeah.
video so that we see, let's interact with yourself.
So I think it was a month ago that Kunle Rija and myself went to Gobi College together. He reached out to me that he wanted me to put this together so that we can, have a little bit of interaction, knowledge sharing, etc., about, healthcare. And I asked him, what is the audience like? So he told me that they are entrepreneurs and all those things. So what I've done is to put like a little PowerPoint together, which I'm going to share, go over a few things with everyone, a little insight into myself. I'm a Lagos boy. So I just came up from Lagos like 3, 4 days ago. I love going to Lagos. Currently,
Recording in progress.
currently I live in Cincinnati, Ohio, and I've been in the state for like 11 years now. I did my medical training at the Lagos State University, teaching hospital in Ikeja. When I left the country after youth service and house job, I was in Grenada. I was like a teacher in anatomy. And I came to the States, specialized in internal medicine, the critical care. So currently I'm a cardiovascular intensivist, basically taking care of people who are really, really sick in the ICU. So that's my specialty. And blood pressure, diabetes, stroke, heart attack, those are bread and butter, basically for me. Interrupt me. I'm trying to see if I can share my screen with you guys. Let me see if I can share my screen so that I can go straight into the uh, see, I can't see the option. But start share. Okay, I've seen it. Okay, on the screen I'm gonna share is this one. Perfect. Can you guys see this?
Yes.
Okay, perfect. So I'm gonna start play from the start. Yeah, so the title that Orija gave me was Well-Being and Successful Entrepreneurship. So when you were talking about health is wealth, see, I prepared this slide like before you and I even spoke. So it says health is wealth in parentheses and all these things. And I put my details there. So, me, I'm a doctor, I'm not a business expert. So what I would just do is to basically home in on a big health issue that kind of cut across, male, female, young, old, etc., and especially because young people, that's the age where we tend to go into entrepreneurship the most, and the common thing that could actually, weigh you down is the topic I'm going to talk about today. And if something is not clear to you, I like that. I would like to have a little bit of audience participation to make it more engaging. People will nod off and sleep while I'm talking. Sometimes that can be boring. Like I said, I'm not a business expert. I'm not an executive. Of course, I've had one or two businesses that I've done on my own here in the States, and I've closed some of them down because they were kind of getting in the way of my career commitment. And if you guys have further question and answer after the presentation, then we can talk about them. So I've chosen high blood pressure. I've chosen high blood pressure because there are 7 billion people in the world. I think 8 billion is the last time that I checked, and about 1.5 billion people all over the world. Depending on the book or your source, some books will quote 1.5 or some studies will quote 1.2 billion people in the world are reported to have high blood pressure. That's a little over 30, about, 20% of the world population has high blood pressure. These are the people that we diagnose. So you can imagine the armies of people that we have not been able to diagnose because they never presented themselves for evaluation, essentially. A significant population of people who have high blood pressure, they are living in what we call low and middle income countries, like Nigeria, Ghana, all this, most of these countries are domiciled on the continent where we are all born in Africa. So in 1990, high blood pressure was the seventh leading risk factor for what we describe as attributable disability adjusted life years. Basically, if you adjust the number of years you're supposed to spend in the world and then maybe you're supposed to spend 70 years in the world, and then the person is supposed to be in very good health for like 66, 67 years out of the 70 years. If they have high blood pressure, it will cut it down maybe to like 40 or 50 years. So the last 20 years, they might even have, you know, have their life expectancy reduced, or they probably will leave it with low quality of life. However, in 2019, blood pressure became the number one leading risk factor where people's quality of life becomes impaired. I talked about the African region, having one of the highest prevalence of high blood pressure. And yeah, so the last line of the slide. So there was a study I read. It was published in I think it was published in Nature journal. They kind of did a survey of the prevalence of high blood pressure in Nigeria. And prevalence talks about how many people have it now, So they were quoting something about 38% is the prevalence in Nigeria, which is a significant number, In terms of epidemiology, who is affected? That particular study, because this is epidemiology based on the Nigerian population. So this is a Nigerian audience, and I wanted to kind of make it more particularly addressing that audience. So when we speak about epidemiology in medicine, we're talking about who is affected, where are they living, who, where, when are these people affected, So basically, if you have advanced age, most people, blood pressure typically is commoner by the time you are approaching 50 and above. Some people can start having high blood pressure in their 30s. Some folks can have it in their 20s. Young kids can have high blood pressure, depending on a certain medical situation that baby is faced with. Children can actually have high blood pressure. So it's not just an adult disease alone. Some kids can actually have high blood pressure. Most of the time in children, when kids have high blood pressure, it's as a result of some underlying organic cause. Could be because maybe the patient has an adrenal problem, patient has a kidney problem, maybe there's some congenital heart disease that the patient needs to be addressed so that the patient can have a better life. So, but the ballpark, most people tend to start having high blood pressure from their 50s, So this other one that says being married or widowed, this is from the Nigerian study. Don't quote me, okay? It's not me that said it all. It's from the Nigerian study. So they're saying that when people are married, especially men in this case, in this situation, the stress of marriage, the stress of providing for the family and all those things, it tends to raise people's blood pressure, which is basically, it's kind of common sense. And if people are widowed, of course, the stress of people losing their loved ones, their spouses, can also, increase their risk of having high blood pressure. When people are unemployed, their risk of high blood pressure is also high. Or if you have a job and you're not being paid, when it's also been said that when you go to university or polytechnic, the chances that you're going to have high blood pressure is higher. Why that happens, we know the stress that comes with, advanced education and all those things. People who don't further their education, they tend to have less stress, less worry about life, about direction. They are okay, they are content with the little things, low physical activity, that cannot be overemphasized. Obesity is one of the biggest risk factor when it comes to high blood pressure, diabetes, stroke, heart attack, even cancer. So those are some of the things that we need to pay attention to. Alcohol consumption. I should have put alcohol consumption with like an asterisk. Asterisk in the sense that, one of my friends conducted a study recently at, I think it was at MGH. It's one of the hospitals of Harvard, cardiovascular disease in patients. And they figured out that moderate alcohol consumption can actually be helpful. There has been some studies that have addressed cardioprotective nature of alcohol consumption. However, in moderation, in terms of being protective against, cardiovascular diseases. But once you have established cardiovascular disease, if you have high blood pressure, especially uncontrolled high blood, of course, cigarette smoking. Of all the things I've talked about, I like to mention two things. Family history is a big deal. If your parents have high blood pressure, you're going to have high blood pressure, most likely. Also, environment where you grow up. If you grew up in a high stress, high tension environment, chances that you're going to develop, all these chronic diseases are very high. So that's where nature and nurture, those two factors, where they come in. Please feel free to stop me and ask questions, if you need further clarification. So how do you measure blood pressure? So we have different ways that we measure blood pressure. Blood pressure can be measured in the office. You can measure it at home. You can use automatic versus manual. Automatic, it needs to be standardized. Like you have to kind of look at equipment, compare it with what we consider a standard equipment that we can trust. That will help you to better calibrate the equipment. Because some of these blood pressure machines that you buy over the counter, you really can't, except when you buy the machine, take it to your doctor's office, let them check your blood pressure, your doctor's office, and also check your blood pressure with the machine that you bought over the counter so that you can compare if there is an accuracy. Because many of these machines, they are not standardized, they're not properly calibrated, quote. When most people are in the doctor's office and they want to check their blood pressure, they are anxious, they are stressed. It raises the blood pressure maybe by a point of 5 to 10 systolic, So some people have been wrongly diagnosed to have high blood pressure, in the doctor's office. Meanwhile, they truly don't have high blood pressure. So one of the things that we've done to mitigate that is we've provided ambulatory blood pressure machines, like for people who can take blood pressure machine home, measure their blood pressure, keep a diary of their blood pressure, send it to their doctor, then they can analyze, the numbers and come up with, a treatment plan for the patient. Typically, we use a non-dominant, like over 70% of the world population, they are right-handed. So typically you check on your left, the left arm, not after you just finished a big bowl of eba amala or apple and all these things. No, you sit down, you rest, and for 5 minutes before you check your blood pressure. And in terms of what defines high blood pressure, if you have consistent readings of 140 over 90 on at least 2 occasions, some books have talked about 30 minutes apart. Different societies have their guidelines, but the consensus is that consistent reading. Patient comes to me first time, 140 over 90. I will give them a few advice. If they come back again, maybe a month, starting blood pressure medication. So in terms of what are the complications? If a patient has high blood pressure and it's not controlled, because it's controlled, the chances of having complications is minimal or are minimal. If they have high blood pressure and they're not controlled, these are where complications start coming in. People can have high blood pressure, be on medication, and still not be controlled. Despite all the medications, they're still not controlled. So they get into the realm of resistant hypertension. Those are the ones that most of the time, tends to come up with bad complications, etc., like stroke, And we know what stroke is. Stroke basically sudden onset of, weakness of the body. Most of the time is usually paralysis of half of the body. People can have visual problem also, manifesting as stroke. People can have speech impairment. A patient can just be speaking and then all of a sudden their speech is garbled. It's gone. That's one of the ways that stroke can actually manifest itself sometimes. Vision loss. The vessels that supply the eye, they're very small. They are very small and they are prone to they're prone to being damaged as a result of prolonged, exposure to high blood pressure. It's not uncommon for people who have high blood pressure to also end up being blind. Okay. Heart failure. So what is heart failure? Heart failure, basically, it's when the heart is unable to pump enough blood to meet the demand of the body for metabolism. So when you've subjected the heart to prolonged years of uncontrolled high blood pressure, the heart becomes weakens, it fails, and as a result of this high blood pressure, and it's not able to meet the demands of the body. Heart failure itself is a big, broad topic that will be very difficult to discuss, during this conversation. Heart attack also is it's one of the I think somebody put in the chat. Yeah, okay, yeah. Sorry. Excuse me, please. So like I was saying, heart attack is also one of the complications that can arise from uncontrolled high blood pressure. And what heart attack is essentially, so when you look at the heart itself, it pumps blood to the rest of the body. How does the heart get its own blood supply? Because if you don't get blood supply, there are very few organs in the body or very few structures in the body that don't need blood. Off the top of my head, I can remember that the cornea, which is basically the covering of the front of the eye, doesn't need blood. But the rest of our body needs blood. So the heart provides this blood. The heart itself gives itself blood. So when the heart pumps blood into the big vessel, called the aorta, the one that emanates from the heart, what happens is a part of the blood flows back into spaces that are open within that aorta and they feed the heart. These two big blood vessels called coronary arteries, they are the ones that feed the heart. Sometimes they are branches, but the big arteries can be blocked. And the blockage of these vessels is what leads to heart attack. So essentially, heart attack is blockage of the blood vessels that give blood to the heart. So when this happens, it becomes manifested as chest pain. Some people might even have like this. You can have, if the vessel is supposed to be this open, and then you have maybe half of it is obstructed. When you do exercises, when you have exertion, stress, anxiety, your blood flow will be more compared to when you're experiencing these emotions. And the heart is beating so fast, needs more blood, needs more energy. And before you know it, the blockage will lead to what we call, ischemia, which is basically reduced oxygen in the tissue. And that can manifest as chest pain. A kidney disease, a kidney failure, like chronic exposure to bad blood pressure numbers can actually make the kidneys to become dysfunctional. And also sexual dysfunction is more about males. Females really don't suffer this. For sexual dysfunction, erectile dysfunction, high blood pressure can be a factor. It could be as a result of the blood pressure itself or as a side effect of some of the blood pressure medication, that we're taking. So it's a double-edged sword. So how do you manage blood pressure? Management simply means treatment, because blood pressure is asymptomatic. Asymptomatic simply means that people don't know they're having high blood pressure. Okay. I can't sit down and be telling you that, oh, I think my blood pressure is high. No, you don't know. The only time you will know that the only time that signs or symptoms can alert us towards the possibility of bad blood pressure or dangerously high blood pressure is when the patient comes with symptoms, bad symptoms like profound headache, blurry vision. Some people may even go blind as their first manifestation of chronic underlying blood pressure that is not being controlled or being properly treated. Some patients can come with shortness of breath, like they can't breathe properly. Some can come with chest pain, some will come with, or they can't urinate anymore. Like the person can pee. It's not as if you want to pee. You don't want to pee, but they basically no pee, because the kidneys are not functioning, they're not producing urine. So, but the ballpark, like 99% of patients with high blood pressure don't even know they have high blood pressure. It's only when you come to the doctor's office, they check your blood pressure, they realize that, oh, your blood pressure is high. Most people that who told you they have high blood pressure, they didn't even know. They just be like, oh, I went to the doctor's office today, and he said, oh, my blood pressure is high, So the question now is, when a patient is diagnosed with high blood pressure, how do we manage it? Medication versus no medication option. Is Agbo an option? I would say I'm going to address this once and for all. Of course, there will be questions. I would say that no, Agbo is not an option. I don't think there's any Agbo or herbs that have been validated. My word, validated, or I've been subjected to randomized controlled trial that we could say that, oh, these things are effective as opposed to some of the time tested, methods that we've used over the years to control and manage blood pressure. Are there food that can help? Come along with me, okay? So this slide is basically talking about stages of high blood pressure. If you're 120 over 80 and below, you are normal blood pressure. If you are pre-hypertensive and stage 1, stage 2, basically the big thing to pick from this slide is just that if a patient has systolic more than 140 or diastolic more than 90, the patient is deemed to be hypertensive. Now let's talk about how we manage these things. Diet. And you guys can, please feel free to tell me or to ask me questions at this point. We're getting to the point where I would really, really like it to be more interactive, okay? So diet. Your food is, there's a saying, there's a philosophical saying that says that let thy food be thy medicine. The number one thing that will most likely, like I talked about environment earlier, apart from genetic factor, that will predispose people to having any form of disease whatsoever. Could be cancer, could be high blood pressure, could be diabetes, could be stroke, heart attack. Think of it. Diet is number one. It's been said that when you consume greens, vegetables, fruits, that your chances of having of having hypertension is minimal. Of course, if you consume, food in excess, there is a risk of obesity. With obesity comes high blood pressure and some other conditions that can come with it. So I don't know if anybody has read or seen or heard of any food or things that they think that they've been told that they could help with high blood pressure. Feel free to chip in, please. I don't. Yeah, I want this to be like, interactive.
Yeah, doctor, I believe that some people told me, using the garlic, ginger. What can you say about that? That it helps.
That's a very good question. Yes. So I was in Lagos in April this year. One of my friends, my childhood friends, a good friend of mine, talked about that garlic, ginger, and all those things. I mean, I read books, I read studies to be able to make sense of that. I really couldn't find any convincing evidence to that effect. But some people, high blood pressure is a multifactorial condition, meaning many things can cause it. It could just be that little garlic, ginger, or thing that you are asking the person to take, it gives the person a little bit of peace of mind, like they're in control of their life. And that might drop their numbers by maybe just by 5 points. And 5 points is a big deal when you're talking about from 140 over 90 to 135 over 85. It could mean the difference between pre-hypertension and hypertension. So those are some of the things that I cannot speak against. When it comes to what is being studied, kiwi is a kind of a little fruit that we have here in the States. It's been said to be, a good source, a good fruit that can actually help with controlling blood pressure. Walnut also has also been said to be a good source of fruit or seed or nuts. So people have talked about groundnut and all those things that they can actually help with controlling blood pressure. But what I can say in terms of diet is salt. The recommended maximum of salt that you can take in a day is 5 grams. If you don't take more than 5 grams of salt in a day, chances that you're going to have high blood pressure. So no, you're going to have high blood pressure. I'm not saying chances. That the chance that the blood pressure could be controlled is high. So a lot of people have cut salt from their diet. When I was in medical school back in Lagos, one of the things my teacher taught me was no added salt on the table. When you finish cooking, don't say, there's no salt in this food, I need extra salt. No, if you're trying to control or manage blood pressure, besides taking medication, salt is one of the things that you really, really want to veer away from, minimal quantity. I know there's somebody in my life who I've known this person for over 30 years now. I've never seen her use salt. She use salt substitutes, alcohol. I talked about alcohol the other time regarding, so I will say it again because we have some people who were not here at the beginning of this talk. So basically for alcohol, if the patient is healthy, if you don't have high blood pressure, you don't have diabetes, never suffered stroke, never suffered heart attack, don't have heart failure, moderate alcohol consumption, moderate. A man should not have more than 21 drinks in a week. A woman should not have more than 14 drinks in a week. I have a slide that describes what one drink is, what is considered one drink. So if you don't have all those things I talked about, high blood pressure, that's hypertension, you don't have diabetes, you don't have history of stroke, you never suffered a heart attack, patient doesn't have heart failure, moderate alcohol consumption is being said to be cardioprotective, moderate. But if patients, and these are studies that have been proven, these are studies that we've known about them. One of my friends who is a cardiologist also did a study recently and he found a similar finding, But for people who have, if a patient has high blood pressure, they have diabetes, they have heart attack, they have heart failure, they've suffered stroke, alcohol is not helpful, I beg, it's not helpful. So supplements. So I put K, which is just the chemical formula for potassium. It's been said that potassium consumption can lower blood pressure. Yes, it's true. But you have to take it in moderation. There are some fruits and seeds that have potassium in them. Yeah. Banana is one of the common ones that we talk about a lot. For other ones like tomato also has some potassium and all these things. Physical activity, cannot overemphasize that people got to get up and move. Our cavemen ancestors, they were not big because they were consistently going around. They were hunting for food. They were running around doing things and all those things. They were busy, you know. So I think these days, because most of us are office based, we do most of our work sitting down. So it's difficult for us to be able to shed the excess weight. But, you know, also calorie restriction, you know, in this Tinubu economy, to eat 3 times a day, it go hard. So that will probably force a lot of people to kind of you know, maybe eat once or twice a day compared to the previous 3, 4, 5, 6 times a day that people are eating. Breathing exercise, you know, people have talked about that. You know, you can go online and look at other forms of breathing exercise. Weight management, it also goes hand in hand with physical activity and stress management. Stress is a big deal when it comes to high blood pressure, you know, because it's what stress does is that so we have these two organs that are sitting on top of our kidneys. We call them the adrenal glands. These organs, they produce many hormones. One of the hormones they produce, or a group of hormone, one group of hormone they produce called the catecholamines. Adrenaline is one of them. Okay. So when people are stressed, there is a high level of adrenaline that is released into the bloodstream. Adrenaline works to raise blood pressure. When people are sick in the hospital, their blood pressure is very low. They're in the ICU with us. Adrenaline is one of the medications we give them to prop up their blood pressure. So there are individuals that they are consistently under stress and they have significant adrenaline flowing in their bloodstream. So that also contributes to high blood pressure. Stress also brings about increased level of an hormone called cortisol, also coming from this adrenal gland sitting on top of our kidneys. High level of cortisol can lead to high blood pressure. So those are some of the factors that, you know, one needs to look into. So anything that stresses you in life, a lot of things stresses us. The economy stresses us. Lack of proper employment stresses us. Family stresses us, you know, just, you know, yeah. So, you know, I talked about salt intake. I talked about 5 grams, you know, per day has been said to reduce, you know, cardiovascular morbidity and mortality. Morbidity simply means sickness. Mortality means death. And I talked about alcohol consumption. Basically, 14 grams of alcohol is pure, you know, pure alcohol drink is 1 drink in a day. I have a slide. I'm going to show you that, you know. So this is alcohol. So ETOH is ETOH basically is our chemical formula for how we just abbreviate alcohol in medicine. So you see this little can of beer, and this is 1 drink. This is 1 drink basically. It's equivalent to this glass of malt liquor, and it's also equivalent to this red wine here, you know. And this is basically one shot, you know, or you know, this is basically 1 shot of whiskey or gin or rum and all those things. This is what 1 drink is. Okay. If you as a man take more than 21 of these in a week, you're in trouble. Okay. Forget about high blood pressure. Also, liver disease is also one of the factors that you're actually, you know, going to have to deal with if you take more than 21 of any of these. So my advice when it comes to alcohol, physician to patient or physician to peers, to friends, is to take it in moderation, you know. And when people have high blood pressure diagnosed, they've had heart attack, they've had heart failure, stroke, you know, I think it's time to actually stop alcohol itself. Because besides hypertension, there are so many other things. There are atrial fibrillation, there's arrhythmias, like the electricity of the heart becomes disorganized and the heart just quivers. That can also kill. And alcohol has been implicated as one of the reasons why people can have those conditions. So this is your 1 drink. This is considered 1 drink. This is 1 drink. This is 1 drink. This is 1 drink. Okay. So if you are taking 21 of these, like you went out, you take 4 or 5 of these in a day, you know, you are doing too much. One should be enough. Besides the other factors, like these things cost a lot of money. When you drink and drive, the risk of having an accident is high, you know. So this is one of these pictograms or picture that I picked. I lifted it from WHO website. It's just to give us a little bit of insight and summary into what I've been talking about all day. We talked about what blood pressure what hypertension is. Systolic of 140, diastolic of 90. When you have numbers persistently more than this number, then patient has high blood pressure, and we should start looking into discussion about treatments, management plan, etc. We talked about 1.2 billion people in the world. It's talking about 1 in 5 women and 1 in 4 men have high blood pressure. That's a big number. They talked about risk factor like salt consumption, low intake of veggies. This is hamburger. People want to come to America. They want to eat burger, go to McDonald's and all those things. There are, health consequences of this thing. Being overweight, harmful use of alcohol. They did not say use of alcohol, as you can see. They said harmful use, lack of physical activity, tobacco smoking. These are the complications like heart attack, stroke, kidney failure, blindness, and other complications, etc. How do you prevent hypertension? This is just basically a repetition of the things I've said. It's like a summary of my slide, basically. Reduce salt, eat fruit and veggies, tobacco, stop tobacco, be active, These are health workers, it's how to detect it. No symptoms does not mean normal blood pressure. Like I said earlier, patients don't have symptoms. It's one of those diseases that are silent killers. Unlike diabetes, where somebody will start peeing a lot, or some people would lose weight, some people will be too hungry, some people will be drinking a lot of water, or some people might even present with weak erection, and that's when they know that they have diabetes. Some women will present with recurrent yeast infection. That's when they know that they have diabetes. High blood pressure does not come like that. I know on the street they will say, "Oh, blood pressure, my blood pressure is high." No, it's not like that. You can't know. If it's not checked, you can be having the biggest headache in the world, and somebody checks your blood pressure and it's low and it's so super normal. You can be having, it doesn't tell you. It's like one of those that they say that, oh, AIDS not the show for face. That kind of thing. High blood pressure not the show for face. It's when the complications arises that you now, start seeing, stuff going out of control. We talked about the numbers, etc. High blood pressure, you can control it if you follow medical advice. Yes, I talked about that. The medicine. So we'll talk more about non-medical, non-pharmacological, non-drug, because dietary restrictions, lifestyle modifications. In terms of pharmacological medicine, we have thousands of medications that we use for high blood pressure. We have recommendations and guidelines that guide us on how to manage blood pressure with drugs, how to up titrate, like go up on the dose, come down the dose, add extra medication, and all those things. It can have a one-on-one later, like I said earlier, yeah. So now I picked this slide from it's a Korean study, because as a physician, we are discussing diseases and treatment plan with people. You need to show evidence, show where you got these things from. So in terms of drug treatment, if you have made up your mind that you want to put a patient on medication for high blood pressure because their blood pressure could not be controlled with lifestyle modification, diet, etc., you start with, we have these four classes of blood pressure medication that we typically like to start with. We can pick one of them. It could be a diuretic, it could be a calcium channel blocker, it could be an ACE inhibitor, or what we call angiotensin receptor blockers, the ARBs. Those are the top 4. We pick one of those or add a second agent. If you don't have any room to go in terms of up titration, you add a second agent. Okay. In some situations, some people are not tolerating the medication. Some medications will give you bad side effects. You need to switch to another one and see, because some patients will stop taking the medication because it's giving them side effects. You need to sit down, counsel, inquire from your patient why they can't take it, why they're not taking their medication, why is their blood pressure not being well controlled. And if the blood pressure is not reached, then you have to put a third medication. The goal blood pressure that you're supposed to achieve, you don't achieve it, you put a third medication. By the time you're having the third medication, it's not working, you see a specialist. You have the privilege that you have a specialist talking to you about this matter. So the buck will stop at my table. Many other things that we do, you might even need to maybe do some investigation, get some urine, get some blood for some special studies. Of course, before you put patient on blood pressure medication, you will have run some tests. But if the blood pressure is not controlled, you now start asking questions. Is this what we call essential hypertension or secondary hypertension? Essential hypertension is there's no reason for this hypertension. It just happened. There's no primary cause. You can look at the patient from head to toe. You don't find anything. It is when you've treated essential hypertension for so long, you don't find a reason, and the patient is not controlled. You now start asking more questions. Is it because their heart, their aorta is constricted, what we call coarctation of the aorta? Do we have reasons why this person, does this person have some underlying kidney disease that is making them, not to have proper blood pressure control? Do they have pheochromocytoma, like a kind of cancer or disease affecting the adrenal gland I discussed earlier? Do they have hypercortisolism? Some other things that could be secondary that would now be contributing to this blood pressure. That if you fix them, some of them are actually surgery. You do surgery, you remove it, bam, patient will do okay. Or there are other medications you can use to actually suppress what is causing the high blood pressure. So those are some of the things that the specialists will now look into. Those things are not within the practice framework of a general physician. So they wouldn't be able to do that. So they will now refer you guys to us, and then we will now take it from there. Okay. Final word. So you guys are entrepreneurs, you're business owners, you are, sole proprietor and all those things. Entrepreneurship is a long game. I can say that because I'm not just a doctor. I've been there. I've done trucking business. I've sold shoes. I've done things, and I'm still going to do more things. So it's a very long game. For you to stay in the game for a long period, you need good health. It is good health that drives longevity of business. One of the greatest businessmen in the world, in the history of mankind, is Warren Buffett. Warren Buffett has been alive for almost 100 years now, and he's been able to succeed in business because he's alive, because he's healthy, So take care of your health and your business will flourish. And I think one of the biggest pillars of human beings in this world, as you can see, 1.5 billion people at least are affected, is high blood pressure. That's why I decided to focus more on high blood pressure. Diabetes, if you guys want to talk about diabetes, we can have a little talk about it today or some other time. There's time, and any other topic, if you bring me back in future, we can deliberate upon it. These are the references I utilized for this presentation. And this image on the right side, top right side, is the campus of St. George's University in Grenada, West Indies. If depending on where you're sitting in the airplane, it's a very beautiful campus. I've seen campuses of many institutions in the world, and the campus of St. George's University is one of the most beautiful that I have seen. I spent 2 good years of my career in this institution, and it's one of the reasons why there's downstate, there's upstate. Downstate area basically is more of a New York City, So New York City has 5 boroughs, basically like maybe they have 5 local governments: the Staten Island, Bronx, Brooklyn, Manhattan, and the Queens. So Manhattan is the big one, which is the one here. Is the one when you talk about Wall Street. When people really imagine New York City, it is Manhattan they're talking about. So Manhattan is divided into 3 parts. There's a lower Manhattan, there's a midtown Manhattan, and there's the upper Manhattan. So lower Manhattan is where Wall Street and all those other guys are. Midtown is where Times Square is, and uptown is known for historical buildings, the old money, and all those things. So when I did my specialty training in New York City, I stayed somewhere here in the uptown area. It's a beautiful area with, a lot of walkways, and shopping, and, the nightlife is excellent. When you talk about city that doesn't sleep, New York City is actually the epitome of that. Been in Lagos 4 or 5 times. I feel like Lagos is perhaps the freest city in the world. It is the city of hustle, but also the city of pleasure. So in everything you do, like the moderator was speaking earlier, try find pleasure, try find time to just ease off, so that you can recuperate, you can recharge your batteries, so that you'll be able to go. Like the Yoruba people always say, they say emi owo, emi ise ogun ju emi eyan lo. Simply means that job, your work, labor, it lasts longer than human life. If your boss fires you today, I'm sorry, if somebody dies today, the next day the boss is going to hire another person to take their job. If your business collapses today, all your people, they will move to another business entirely. So just take care of yourself, be nice, be fine, and enjoy life, and find time to relax and chill. So
thank you, Dr. Yomi. That's a very insightful one and very brief and straight to the point. And we appreciate that. I saw my auntie, my auntie already has a meeting here. So I understand where you're trying to say, let's relax our brain, let's relax our system sometimes. Sometimes taking a walk and all that. Please For the Instagram, Facebook, we have a lot of questions. I see a lot of people are going through different things, but I don't think we might be able to take all these questions, but we can manage the one we have. But from the Zoom part, if you have a question, because all this thing is still related to your business. If you take good care of yourself, your business will know. It will tell on your business. And if you don't, I don't. I can imagine two of my friends, colleague, we lost them. And just like what Doctor the facilitator just mentioned, see, I tell people when people comes to you and you think without you they won't live their life, they will. You can test it. I have a lot of strategy that I tell some of my people that come for me for consultation and all that. When I engage them and I hear that, see, I have a lot of people in my head, that people are coming, people will ask me for this. I tell the person, you know what, do this strategy. I do it well. I will give it to you guys. That tell the person when they call you for emergency, someone that called you, please, sir, I have an emergency. I need XY amount, please. How can you tell the person, oh, you weren't aware of this? Can you give me till end of the month? If the person tells you no problem, how is that thing emergency? For you to know that most of those people, they take advantage of us. You said it's emergency. I said, oh, sorry, I don't have the cash now. Can you wait till the end of the month? This person will wait. If the person called you back at the end of the month, it's for you to know that they can do without you. Definitely, it must have gone to somewhere else to secure that thing. Now, imagine if you are not there anymore, the life will continue. So don't look at yourself that you are indispensable. That without you doing this thing for these people, there's no way they will get it. They will get it somewhere. The first thing you need to understand is your mental health. If you're okay, that is when you will be able to do all these things we're doing. And that is applicable to your business. I can lead my business from your work. That is the reason why they give us holidays. When I was still working with oil company and all that, they will tell you, go on holiday mandatory. Mandatory that you need to go. Why are they doing it? Because of your mental health. But most of us, money, money, money. When you get this money and you don't have the health to spend it, I don't know where we're going. But if we have any question from in-house, and while I go straight to the people that we have a lot of come popping up, but let me take this one. It says, sir, we really appreciate you coming on board, and that is a very insightful presentation. Sir, I will need your advice. I do have a constant side I do have a constant side headache often, and I notice it is when I think about my undone business or tax that this thing always pump up, and it has been coming.
And I think the person already self-diagnosed themselves. Like this is a work-related headache or stress-related headache. It may not be totally unrelated. It may not be related to blood pressure. So what I would advise the questioner is to get their blood pressure checked. It's just they should try. It's very. I don't. If the person is in Nigeria, I know it's very tough to really just walk into a place and say it because I know things are quite expensive to see a doctor. And all these things. It's tough. I'll be very honest. The way we organize healthcare in Nigeria is a little complicated. Unlike in some other places, even a store, a pharmacy, they will have blood pressure machine by the side that you can go in there, or a supermarket, like what we call it back home. Supermarket will have blood pressure machine. You go in there, you check your blood pressure, you walk away. So I will advise the person to check their blood pressure. Because the headache might not be, I don't have specific details of this person. Are you a man or a woman? How old are you? And all these things. But, things as simple as taking paracetamol, if it doesn't help, then I would think that you should check your blood pressure. May not be blood pressure related. You might also maybe need to do further testings. You know what I'm saying? So don't take it as if, this is just stress related, especially if it is not responding to medication and may not be related to blood pressure at all. Because most times, like I said earlier, blood pressure does not come with symptoms. By the time it's coming with symptoms, it is complicated. That matter don't pass blood pressure at that time. It don't become other things now. Maybe so that thing itself, they're more powerful than the blood pressure itself, will cause the palaver in the first place. So I think the most important thing to note is that blood pressure does not cause symptoms, So I think that basically answers the question for the person.
Okay. I think that is well taken. This is from Facebook. I think that question has been answered. We also have someone in house, Mr. Babatunde Badmos. Can you unmute yourself and ask the question?
Good evening, sir. Good
Good
evening.
evening, sir.
Good evening.
Yeah. I want to know if exercising with blood pressure, when does it become a stress on the blood pressure?
Fine. Okay. But this is what I'm going to say. Don't overdo things. Okay. Do not overdo things. If somebody who has high blood pressure is not the kind of guy who will be running all over the place every now and then, the most important thing is to be physically active. Don't be redundant. Don't sit in one place and be immobile and all those things. Control your weight. Don't be overweight. Things as simple as running on the treadmill here and there should not be difficult, shouldn't be an overdue. But by the time you want to do too much, especially for people who have high blood pressure, uncontrolled blood pressure, because the blood pressure could be so high that it could rupture vessels in the brain. And when you now combine that with sometimes weightlifting and transmits to the blood vessels in the brain, and the brain, depending on the weak spot that has developed over time because of high blood pressure, it could burst. And that has happened. We've had case series of patients who had ruptured intracranial vessels from straining and all those things. So I would say treadmill exercises, push-ups. A good question, Mr. Badmos.
Thank you, sir. But what about trekking?
Trekking is good now, Baba. I beg trek.
Or tell us if you don't have transport, let us know. Don't turn trekking now to because
trekking is good. Especially if the person is big, let them trek.
Because we know what Nigeria is not. You know,
lose weight, but drink water. Drink water.
Start trekking.
Yeah.
Anyway, that's good one. Doctor, please. I do visit the restroom often of late. I wouldn't know what is the cause of it, and I have this uncontrollable urine, and I don't know if it's attached to anything that you've spoken.
Very good question. Also, I will only give the person one answer. Please go check your blood sugar. Okay.
Is it related to blood sugar?
Yes, please go check your blood sugar. It could be most likely if you're waking up every time to pee, it could be because of blood sugar, and also it could be because of big prostate. You understand? But at the same time, please check your blood sugar. Be sure that it's not diabetes. If you can rule that one out, then see your doctor. Let them evaluate you for elevated prostate and see, for enlarged prostate, and see where to go from there. Okay? Those are the two big things I can think of now.
Okay. I think this is related question too. Sir, I won't want you to mention, I won't want you to mention my name, sir. Please, sir, in the case of prostrate, is it related to IBP? Or how can I relate it to what we have today? And should I be having frequent sex? Can that control it?
Woof. Tough question. Prostate and high blood pressure, there might be some association. Sorry, I don't know if you use the word association or there is no correlation. There may be association. It's possible. As long as you are a man and you live long, the chances that you're going to have big prostate is high. We all pray for long life. As long as you're a man and you live long, the chances that you're going to have big prostate is high. The chance of having prostate cancer now relates to if you have family history of prostate cancer and if you have risk factors. I wouldn't go into details of that because I am not, that's not the topic for today, but just to answer that person's question, prostate has no relationship with high blood pressure. That would be my answer. There could be some association, but there's no relationship between prostate and blood pressure. If patient has prostate issue, that prostate issue can be existing on its own in isolation without any relationship to their blood pressure. Maybe the stress from the big prostate because they are finding it difficult to pee sometimes, or they pee a lot, might also now had and be a secondary factor. That is a possibility. That's why I'm saying association may come in, but correlation or causality, no.
Okay, thank you.
Yeah.
Some of this question, I might not take some. some of these questions because they are not related to what.
Oh, and there's something about sex. We'll say something about sex. You know,
Okay.
there's been many
He said the frequent
conflicting.
sex. Okay, he said, should I be having frequent sex? Okay.
There are many conflicting studies that have come out about, oh, if you have a lot of sex, you're not going to have a large prostate. Some have said, oh, if you have sex, you're going a lot of sex, you're going to each man his own. If you want to have sex every day, good luck. Sex is good. It is a stress relief medication. It can actually help you a lot. It helps well-being. It helps. It's good exercise for the heart, you know. But that is going to change the configuration of your prostate. I don't think so. I don't think that. I don't think science has a definite answer. And if science doesn't have a definite answer, I don't think it is appropriate for anybody to advise people or give people definite advice, because I live in a society where you could face litigation for giving wrong advice, so I have to be wary of that. Yeah.
Okay, let's take this from this from the Instagram. It says, can I manage stress? Can I manage stress to reduce the risk of my high blood pressure?
Yes, there are many ways that people can manage stress. One of the things I always attack Lagos for, because I'm a Lagos boy and I love to talk about Lagos, is that Lagos is not a romantic city. You can't just wake up one day and say, I want to go to the beach and chill out at the beach. Most of the beaches have become private now. The common man doesn't have access to them. Okay. We don't have parks where people can go around, play around, have picnics. We used to have amusement park when we were growing up. I don't know if it is still available today. We don't have nature, except if you go to the villages, you have nature and all this. There are other things you can do. People relax by swimming. People relax by going to the cinema. People relax by, just chilling with friends, family. As a matter of fact, going to parties, social events is also a form of stress relief for some people. You can go swimming, and there's been a talk of yoga, massage, those are forms of relaxation. Ultimately, get enough sleep. On the average, 8 hours of sleep. It will help a lot. Okay.
That's a good one. From the chat room, Florence asked, good evening, sirs. Thank you for doing a good job. Please can having a sleepless night be the cause of high blood pressure?
It's possible. Like I just mentioned now, insomnia, which basically is inability to fall asleep or sustain sleep or have quality sleep. It could be a factor when it comes to, blood pressure. So it's something that you need to address with your doctor. There's some things we call sleep hygiene. You don't watch TV. You take the TV out of the bedroom. You don't watch TV, when you're supposed to be sleeping. You don't do other things in bed besides sleeping, and maybe if you're married and you have a partner or something, that other one. You know what I'm trying to say? So
okay, Florence, I believe that question is well answered. Another question from here is, what is the potential impact of high blood pressure in a personal life?
many impacts, it's from head to toe. I talked about stroke. I talked about blindness. I talked about heart attack. I talked about heart failure, kidney failure, sexual dysfunction, and also blood pressure medications are not cheap. So economic factor also, quality of life also, and the fact that people even have blood pressure also can actually affect their psyche. They're not happy, that I have blood pressure, I'm treating this thing, and it's not being controlled, it's not going away. People can actually, those are also the side effects, of blood pressure, that is especially uncontrolled.
Okay, I'm taking this from Facebook too. It said, you are in an advanced country, sir. I would like to know what does technology plays in helping managing high blood pressure and to stay healthy on the go?
What is called ambulatory blood pressure. You can strap on your blood pressure machine and do your activities, be running around all over the place. And in real time, your numbers can be transmitted to your doctor's office. That will help them to be able to make a decision on changing or adjusting your medication. You can have blood pressure machine at home, check maybe twice in a day, and your number will be transmitted directly to your doctor's office. That's in terms of management of blood pressure. And I feel like the person is trying to say, can technology help us to prevent blood pressure? And
I
I think
guess
that's
so.
the way the question should have been framed, yeah, especially with the explosion of artificial intelligence and all those things. I don't know, but what I can say is this: I think technology can help us to be able to predict who will develop blood pressure, later on in life. If we subject everybody to like gene analysis, when you analyze people's gene, you'll be able to tell which person is most likely going to get high blood pressure. But you don't need to do all those expensive things. Daddy and mommy, daddy has high blood pressure, or mommy has high blood pressure. Chances are going to have it is high. Don't even stress yourself. Just say, my mom has it, my dad has it. I will most scientific innovation that can prevent it. I don't think that's possible, but that can warn you that this is on the horizon and make you put in measures that will prevent it from happening, because most of the work will be done by you ultimately, not by the machine or any technological invention,
Okay, good. Thank you. This is a question. Okay, let me take this one before others. I don't know the English for Urubu, but my grandmother told me Urubu takes a lot of stress out of me, but I've not gone for tests.
Before the person can say that Orobo is up, let them go for tests first. Orobo is bitter cola in English.
Yeah, that's
Uh,
bitter cola.
a lot of people have talked about it and everything, but I think the problem with our people is nobody has gone for tests. And the truth is, I'll be honest, some people can live with blood pressure without knowing they have blood pressure for many years. For thousands of years, they will not even do anything. They will drink beer, they will smoke cigarette, they will party. They live there till they are 80 years old and they will just die. You won't even know they have high blood pressure. Some people are that designed because how we respond to medications, how diseases become complicated is determined by a lot of factors that even science has not been able to identify. It's not just that, you have a high blood pressure, you are going to have a stroke. You have high blood pressure, you're going to have a heart attack. No, it doesn't work like that. People can have high blood pressure and not develop those things, So, yeah, I don't know. The Agbo thing that this person is talking about, like I said earlier, Agbo has not been validated. There hasn't been a comparison, like a head-to-head trial comparison with Agbo with what we know that works. For me to tell you that, Agbo works, so go and take Agbo. If you want to take Agbo, it should be a personal decision. It should not be coming from a physician,
Yeah. All right, I think you've gotten that. Agbo, if you think it's okay by you, it's a personal decision. I think that's will take that on. What LD habits can I incorporate to my daily routine to support my prostate health?
Prostate health. Stay with one partner. That's the first thing I'm going to say, because infection, if you have prostatitis, that could damage the prostate, that could increase your risk of having impaired prostatic function. I think that's one of those things. Drink enough water, exercise, just live a regular, healthy life, because there's some things that you can't prevent. I cannot think of anything that maybe there's something science has cooked up. I don't know at this point that I'm speaking, if something comes up, I can send it to Orija to send it to you guys. But in my opinion, if a patient is going to have prostate enlargement, they're going to have it anyway. But just stay away from smoking, stay away from excess alcohol consumption. Have one partner. If you have infection, treat it. Also treat your partner, So that's some of the things that I can think of off the top of my head now.
Okay, let's take this from Facebook too. This president actually said, how can I encourage? No, that is personal business there. Let's take this other one. My health habit. No, I can't take that. That is personal. This is sorry, please. Some of the questions you're sending in, let it be this topic related. That is why you might see I'm skipping some of these questions because it's not related. So that's why I'm skipping it, please. So pardon me for that. There's some of the questions I won't be able to take care of online, but you can definitely charge out. I can we see how we can help out in that area. So okay, let me take this one. Sir, thank you for giving us a good presentation. We like what you do. Engineer, thank you very much. My question is, how can I reduce my risk of developing diabetics or manage the condition if I've already been diagnosed? You will need to unmute yourself.
Yeah, sorry. Yes, diabetes. How can you? So there are two types of diabetes, or there are two big types of diabetes. There are other diabetes. I'm not going to talk about them. There are two types. There's one that you can't control. It will happen if it's going to happen. It's called type 1 diabetes. Typically start with children and all those things, you know. Then there's type 2, which would happen. We can prevent it from happening. Weight control, very important. You know, exercise, everything you are doing to prevent high blood pressure, you can also do that to prevent diabetes at the same time. One other thing is diet. If you are taking too much sugar, too much refined sugar, you know, your pancreas, which is the organ that produces insulin, will be overworked. And it's insulin that drives excess sugar out of the blood, you know. Yeah, a lot of our food is, can you guys hear me?
Yes.
Yeah, a lot of our food is carbohydrate based, you know. I think the big thing is just the sugar. If you consume it, I don't want to spoil business for any company, but I'm going to say that if you consume a lot of soda, soft drink, okay, I will not mention any company's name, but if you consume a lot of soft drink, the risk of having diabetes is high. If you put a lot of sugar in your gari, sugar in your tea, you know, the risk of having diabetes is high. So you have to look for sweeteners, which are substitute for sugar, you know. If you are the kind of person that has sweet tooth, all this ice cream and all those things, you know. And if somebody thinks that they could be having diabetes, especially if they are peeing a lot, they are thirsty a lot, or they are hungry a lot, or they have family history of diabetes, they should go get checked. I think the most important thing is getting tested. If you don't get tested, you can't know that you have a condition.
Okay, I think that is well taken. Okay, let me take this question. You keep repeating it, you keep sending it in. Sir, please don't ignore please don't ignore this message. This is the fifth time I'm sending it in. Sir,
Okay.
how can a child of 6 years old have been diagnosed by diabetes? Is that possible, or is it Nigerian factor that is doing this to me?
Yeah, I've answered the question earlier. Anywhere in the world, there's a condition called type 1 diabetes. Children can
You
have
said
it.
6 years old.
Yes, children can have type 1 diabetes. Yes. So it's possible. Yes.
So I think that is well answered. I think you keep beginning. I guess you should be the same person sending it in. What about if the father and the mother does not have a diabetes? How come a little child has diabetes? Please, can you explain this, sir?
Many reasons. Patient can have viral condition that can destroy the pancreas, leading to type 1 diabetes. The parents may not have to have it. I know people whose parents didn't have diabetes and they have diabetes. These are kids, children. So there are some conditions that we describe as idiopathic. Idiopathic simply means we can on maybe some autoimmune, maybe the body is fighting the body. So those are some of the explanations that I can give for that.
So, engineer, are you saying that hereditary? Are you saying? Are you saying? Look, I think you wanted to say. Are you saying prostate is hereditary, just like BP?
Nope, I never said that, and I will not say that.
So prostate is not hereditary.
I don't think hereditary simply means you inherit the gene. No, I don't think it's hereditary. The risk factor is just I wouldn't really say it's hereditary. You know, it's just that the risk factor is if you have a family history, the chance that you're going to have it is high. But it doesn't always have to mean you're going to have it, because your lifestyle could be different from your parents' lifestyle. You get what I'm saying? Yeah. Maybe you have life and you know how to manage stress properly, and you'll have a good relationship with your business, with your spouse, with your family, with your friends, and you don't care about the economic situation. You don't care who becomes a president or the governor of your own states, you know? Some of those factors affect people. So I think, yeah. So because your parents have it, it becomes a risk factor. It is not a definite factor that you're going to have it. There's risk factor, there's definite, you know?
Yeah, please, engineer, thank you for bringing Doctor on board. This one has really given me an edge over things that I need to know. My business will still scale more. But the question is, I'm having something which I believe maybe at this point they can answer it. Sometimes when I'm driving, I will notice that I will just blank off. My eyes will be white off for some minutes and it will come back. But it keep coming once in a while. Is it part of high blood pressure or what? Because I've gone to the hospital where they tested it. They said I don't have anything with eye blindness. But I notice sometimes it will just go off. I won't see anything for some time and it will come back.
That's a very serious condition this person is describing. And if I were this person, my question would be, which hospital did he go to? I don't think that any physician or clinical expert will encounter these kind of symptoms and wouldn't get this patient to do a CT scan of their brain or have a proper ophthalmological evaluation where they will look at their retina, which is basically the part of the brain or the part of the eye that connects to the brain that interprets our vision and all those things. This person needs urgent physician evaluation. This is not a joke.
So what you're saying, I'm still trying to imagine how can something go off blank and come back.
There's something we call amaurosis. What is describing sound to me like what we call amaurosis fugax. But people just have intermittent blindness. And this could be as a result of bad eye blood pressure. Yes. Wow. So this guy needs to go. He needs to see someone.
And when what about if maybe the person is not even using glasses? How can someone just go blind just like that, come back?
This is not a glasses issue because glasses are basically a refractory problem. Like, okay, patient has a short-sightedness, long-sightedness, or the other one that affects older people, you know, which I can't remember the name now. Those are refractory issues. But this guy is talking about vision, like sensory. He cannot see. That's a big deal. Okay. Astigmatism is the one I was remembering. That's when people are growing old and there's even curvature of their lens and all those things.
Okay. From the chat room, wow, I have missed a lot, but since we are discussing about our health and job, how do we register with HMO that is pocket friendly? All right. My guest speaker is in US, and if you for that, you can drop your number. Only we pick it up. We will introduce you to the series of HMOs, the one I'm using, and the other ones that you can patronize. But I can tell you, we have different ones that you can. It's very good for our staffs. At this point, I'll tell you, people are running away from HMOs because the price, but they've made it more friendly and more flexible. Because what I noticed when we started, some of the companies that use
1 minute, okay? 1 minute.
Okay, please.
1 minute, okay?
All right, please. The HMO thing, please, you can do it for your staff. It's very important. It's not even expensive the way we see it. Do you even know that the way I run my own business, they are the one, most of those things that you're talking about is being deducted from their salary. Because you can decide that is the part of the company, you give it to them. And you can even tell the company that this XY amount is what you want to apportion for each staff. And they will tell you they're due to go. And that one will cover some things, but there are some that it won't cover. So drop your number, we'll pick it up. And through that, they will explain to you. I'll give you some numbers that you can patronize. It's very important. And the HMO of the thing, some of the company that we have, they've added it to their requirement. If you want to get a good job now, that you want maybe you're trying to get a retainership, you want to deploy your staff, you want to do that. Some of those companies that we're talking about now, they will tell you, bring your certificate of it, that if you have an HM, if you have an X license, or that you're registered with them. And this thing started from when La Cepa and some government agencies, environmental, because most of our staffs, let us be truthful with ourselves. Fine, we are not making good money. Some will tell you, how much am I making that you want me to register as an HMO or to give them this health facility? But I can tell you it's friendly and it's flexible. If you include it in your business, I can tell you there are some jobs when people talk about, let's talk about the doctor has been giving us good insight. I know you guys are waiting for engineer to talk about the business part and all that. Most of us said we are not getting jobs. Do you know that when you write your proposal and you included that even your staffs are under privilege, benefit of the company? A lot of us will write proposal, we don't even have. What's the benefit that you give to your staff? When you put it and some company reads it and they will tell you, oh, this is a standard company. And how much is all those things? It's not that expensive. Fine. Those days, now do you know that what we were looking at, some of those people, you give it to them, when they don't use it, they will tell you, it's like people see it as insurance. When you do the insurance and nothing happened for that year, that is their luck, but you don't pray for anything to happen. So please, we'll take it off from there, and a link will be dropped for people that wants to join our community, so you can join to get more updates on anything about the business, how you can scalable, how you can scale, how this business that are scalable and all that. But please, the HMO is very important. A lot of us don't have it. That is why if you that you don't even have HMO for yourself, how will you even create for the staffs? That's another thing. Most of us, we eat all what we have. The little money that comes in, we don't even intend to bring out some portion of it for medicals. So when you do the HMO, it's going to work. It will work. It's even automobile now that they even make it that they can automated it. That 3 months they will tell you, sir, you need to let all your staff to come for checkup. Those are the things that we are using. So it's very, very necessary. We will send it to you. But today we're looking at the earthwise, how it can be it can have effect on our business. Let me take this few questions. Some of the questions I just have to scale it up. It's not related to, we can't take more. Okay, this one is talking about it's a business. Well, okay, he said, how can I create a wellness friendly work environment that supports employee health goals? So, Dr. Yomi, do you want to put an impact on that? He said, how can I create a wellness friendly work environment that supports employees' health goals?
First and foremost, pay your employee, pay them what they are worth. When people feel like they are being rewarded for the work they are doing, they are they are motivated, they want to come to work, they want also your business is going to prosper. One other thing that I've, as an employee myself and somebody who has employed someone, be generous with paid time off. Like when it's time for people to go on leave, annual leave, let them go on annual leave. There are businesses that doesn't allow people to go on annual leave. That's not good. And also, if you tell your employees that you're supposed to resume at 8 and close at 4, keep your words. Don't say that, oh, because I'm still in the office and I'm the CEO, you can't walk out of the building at 4 o'clock or 4:15. That's not a healthy work environment. That's not a healthy work environment. And like you said, give them this impression that you are prioritizing their health. HMO, register them under an HMO, encourage them to, to distress, to spend time with family, with friends. If they want to go on vacation, encourage them. Maybe they're applying for visa at the embassy, give them letter to support their application, so that they can enjoy life. I think those are some of the things that you can, and from time to time, little office party, office socialization also helps. I think those are, Coach, you can add any other insight. Those are the things I can think of off the top of my head.
Yeah, thank you for that. You've mentioned most of those things. That's something. Let us have a bond. Team building. Create team building with them. Let them go for team building. All those things helps your business, and their health will remain safe. You can get to the office, ask some things from them, tell them, have your safety. Some of us, we don't even, those that have offices, we don't have the safety We don't have first aid even in the office. They are entitled. Not that you're giving them, though, they feel that they should be entitled. But let them just have that atmosphere that this company thinks about us, not only him, and his business. Or so it doesn't work. That doesn't work. But let us do that, and it helps. And that's a very good one. So, this question, someone is asking this question. It's no, that one can be asked here. I've said it, please. I still mention it. There's some question you're sending in. You need to visit your doctor. You need to go to the hospital. There are some things he can say here. So you just need to visit your doctor. He has come to enlighten us on some things. He's not testing us. He can't test for you. It's only when he tests you, he can give you some answers. Please, I'm very sorry if I don't take your questions, but some questions are too personal. You need to go to the hospital to do that. Okay, this one is okay. He said, sir, how can I encourage my employee to prioritize their health and wellness and to deliver my business?
And like I mentioned those things earlier. So I think that also pivots on the other question that was answered. Beside, give them good pay, provide them the avenue to know that when it's closing time, it's closing time. Be sure that when it's time for them to go on their annual leave, and they have annual leave opportunities, they are registered with a decent HMO. And then there's some other things that we do also that I think that could be incorporated. There are some days that we call sick days. Like you could give them, like in a year, you're allowed to call off maybe 5 days in a year, or every quarter you're allowed to call off twice every quarter. You can just, maybe the employee may just want to stay home and enjoy family time. So okay, give them that flexibility. Create like a family environment at work. Don't yell at your staff, like don't shout at them. No, that's not how to be a boss. If you have to raise your voice to talk to people that are working with you, for you, who are helping you to build wealth, then you are not worthy of those people. I think those are the ones I can actually think of now.
Okay, I think that's I will still buttress it. We have a chat from the chat room. We will okay, taking HB, okay, high blood pressure medication for 4 months due to white coast syndrome, when in reality my BP is normal. After the ambulatory check, have any negative impact on my health? I'm trying to see.
Yeah,
Okay,
the person is talking
after the
about
ambulatory check,
that they've taken
any
blood pressure
negative impact
medication.
on my health?
The person said that they've taken blood pressure medication for 4 months. Before you can actually say that truly that you have, there are so many factors. Number one, is your blood pressure normal now because you're taking that medication? Number two, before I can take you off a medication because we think that maybe what you have is white coat hypertension, I want you to keep a blood pressure diary, honest blood pressure diary. Though we can circumvent that these days by giving you a blood pressure machine that will transmit the information once you finish taking it to our office. You understand? You take 2 blood pressure, let's stop your medication. Let's do other things, your diet, exercise, reduce salt, and all those things. But because it's easy for nobody wants to take medication. I don't want to. I'm a doctor. I give people medication every day. I don't want to take medication either. But sometimes these things are necessary. They become necessity because you need them to stay alive. The question is, if you've taken blood pressure medication for 4 months, despite not having high blood pressure, I don't think that any harm has been done. If you don't have high blood pressure, truly, you liaise with your doctor, you guys have conversation, you stop the medication. Any effect that the medication may have had on you in 4 months, it will disappear in a couple of weeks. So you don't have to worry about long-term effect for a medication you take for 4 months.
Okay, let me take this question. Is it possible to eradicate? Is it eradicate he wanted to use? Okay. Is it possible to eradicate high blood pressure after taking the drugs and you go to church and they pray for you? Is it possible? Because my doctor said The moment you have high blood pressure, you just have to manage it throughout the section of my life. But my pastor has contradicted this. Doctor, please, what is your take? Please, I'm begging you. I'm begging you.
I am a spiritual person. I am not religious. I don't think that prayer is going to solve high blood pressure, in my opinion. You know, I believe in prayer, but I don't think prayer will solve high blood pressure. The Bible says that work without prayer, with prayer without work, you know, is dead, right? So you can pray, but if you're not doing the work, nothing is going to happen. Your doctor is probably right. 90% or 99% of the people that I know will end up taking their blood pressure medication for the rest of their life. Some people may have to go off the blood pressure medication. The reason could be because the blood pressure dropped too low. I will put them on the, we'll start cutting back. And some people will go off it. Most of the people who go off blood pressure medication are old people. They're so old, the blood pressure has become so well controlled that they've now started having symptoms of low blood pressure. Their kidneys are beginning to suffer because of this persistently low blood pressure. So we now take them off these medications, but we monitor them closely to be sure that the blood pressure thing is not rebounding, is not coming back. But to say that your pastor, who doesn't know anything about the human body, is now telling you that he has prayed the blood pressure away. Me, I don't know. When the stroke comes, when the heart attack comes, let's hope you'll be able to pray it away also.
Well, from my own side, I believe do your medications. Pastor will do their own, but you can't tell me what you've not tested, you've not gone for test, and you believe. Fine, let's believe in faith. If you have faith, but sometimes let's be diplomatic about it. That's what I would say concerning that. So we're rounding up by 4. The next 20 minutes we should be rounding up because this question is too much for us to go into. Okay, I can't take this. Sorry, the question that keep coming, please let us do a direct question concerning this topic. Most of this thing is not something we should be taking. Okay, I will manage to take this. Sir, I love taking black coffee, and I realize that I have high blood pressure. Should I stop it, or what is your advice?
It depends on the quantity you take. If it's just 1 cup in a day you're taking, I think it should be okay. If you're taking a lot, 3 cups, 4 cups, you're looking for trouble now. Because coffee itself causes a lot of anxiety, palpitations, and all those things, you know. So I think the person should moderate their coffee. If they can do without taking coffee, I would say yes. But if they can't, maybe 1 cup a day should be fine.
So you mentioned something about salt, 5 grams, and but from what I know, my own mother do tell me you shouldn't take a raw. What do you mean by raw salt? You shouldn't take a raw salt. It's talking about that we shouldn't be taking a raw salt. It has to be cooked before taking it. What do you mean by 5 grams? Are we going to take it direct into the food?
So that's it. So when I talk about 5 grams, like measurements, the quantity of the salt. You can take it cooked. You can take your salt like that, you know. Typically, who takes salt raw? We use salt to season food so that the food can be palatable. You understand? You know, so gram is talking about, like if I say drink 5 cups of water in a day. So you measure your salt. You don't do too much. You know, because it's difficult in many environments to measure salt. What we've advised people is this. When you cook your food and the food is ready on the table, don't say there's no enough salt and you now start adding extra salt on top of your food. That's my advice for you. Either you take it raw or you take it cooked. There's no difference, okay?
Okay, that's good. I think that is well answered. I think your question has been answered. So please don't quote what you hear. You need to hear the real thing and not what he's saying is different from what you were asking. So please let us be guided.
Yeah.
So the question is what he said, what are the financial implications of post-trade issues on my business and how can I mitigate them? These are no questions. Doctor, what do you think? These are no questions It's a personal question. I'm sorry. It's a very, very personal question. So that would not be. See your doctor. That's what I will tell you about that. But you are trying to relate it with the business. So anything about no, that one will be taken. I'm sorry. If you have any other question, you can send it in, but that can be taken. How can I balance work and self care to prioritize my health? All these questions are not. All those questions are just something you should be able to know yourself.
I mean, some people might find it very difficult, maybe because they have many children, you know, or maybe because the business needs to have them to be there to be able to break even, to even be able to make money, pay the bills, and all those things. My advice for such a person is hire business consultants. They can help you with, improving your business, upscaling your business, and all those things. That will now give you, once your business is now doing well, is automated, it will give you time to be able to now prioritize yourself and all those things. In the meantime, also see a doctor or see an healthcare worker that you're comfortable with, because I know in some societies, people don't see doctors anymore. They see nurses or nurse practitioners.
Okay, let's just take one more questions while we call it a day, because the questions coming are too personal, and you can brief us on some other things. This one's okay. This one is saying, what is the legal implication of diabetes to what is the legal implication of diabetes in the workplace, and how can we ensure compliance?
I don't think there's any legal implication of diabetes in the workplace. There's no relationship, please.
That's why I said those questions. Okay, sir. Doctor, please. I want to know. I'm in the United States, and you will understand what I mean by most of the jobs that I go for. They always carried out drug tests and some other tests. What is the significance of these tests they normally carried out, which is not even done in Nigeria that I was coming from? Is there anything correlate with that, sir?
So that's a very good question, actually. Every job that you do in the States, you will do drug screen. And there are some states, like in New York State, I know for sure, especially in New York City, we don't screen people for cannabis, Igbo, anymore. We don't. Because it's been adopted as a legal drug and all those things. So for other ones like phencyclidine, opioids like heroin, cocaine, and all these things, we still look for them. So what happens is, you see, drugs impairs people's ability to function properly. If I'm going to hire somebody to maybe drive a truck for me, and the person is high on cocaine, or the person is an alcoholic, or the person is using a heroin, that person is not going to function. That person is going to destroy themselves. Then, as a consequence of that, destroy my business. That person may even attract, trouble, crime, to themselves. And also, people who are drug users, they spend a lot of money on those things. They become desperate. It pushes them into crime. It also pushes them into theft. Especially if you're handling money for your boss, for your business. You are more likely to steal from the business, if you are addicted or hooked on drugs and all those things. So I think those are some of the things that I can think of at top of my head. I'm a physician, and I wouldn't want my doctor to be using cocaine. I wouldn't want my doctor to be using heroin. Even common marijuana or even alcohol. Don't smoke marijuana and come and take care of me, or drink alcohol, come and take care of me. No. So those are some of the things, some of the reasons why they do all those. And you shouldn't be worried. It should be the last thing on your mind. You want a job, come clean, come sober,
Doctor, you know what? From the last part of this question, it said, which is not done in Nigeria. You don't need to compare. Nigeria will employ you. You don't need to
Nigeria, everything goes in our home country. We allow a lot of impunity to go away without being punished. So they don't do drug screening, but they do health screening. They at least say get chest test,
some companies do
blood work, do urine test, and all those things. So
okay, there's a question in the chat room. What diet and lifestyle will you advise for low blood pressure male with post-weight challenge?
Oh, good question. So the prostate challenge you are discussing, you're telling me is not specific. Does this person have prostate cancer or do they have enlarged prostate? If it's enlarged prostate, there are medications we use for enlarged prostate. Okay. There are medications that we use for enlarged prostate. But if it's prostate cancer, the person needs to be treated for prostate cancer, and in some cases, the prostate can become so enlarged and they might need to have surgery to take it out. So you have to
enlarged prostate.
Enlarged prostate. Good.
Just
so there are two things we do: medication, or you can get surgery. So the person will need to see a urologist. It is urologist that will decide the appropriate modality or the appropriate approach to managing this patient's condition.
Okay. Is that taken from the chat room? A question again. We're about to round up. The more you guys are sending in this question, a question again is that, sir, you've been mentioning high blood pressure, but the issue that I have, the last time I visited my hospital, I was told I have low blood count, that low blood pressure, that I need to boost it. I'm confused. Which one is better, sir?
So I cannot speak to that because I need exact number. Is this a man or a woman? Okay.
I wouldn't know.
Low
blood pressure and
you can't be if the person has low blood pressure, they will be, and it's truly low, like dangerously low. They will feel dizzy. They might even pass out. They won't be able to do their day-to-day activity easily.
Is it the same symptoms? Because you just mentioned something. A low blood pressure, is it the same symptoms, right?
No.
Is that too bad?
No, so if a patient has low blood pressure, they will have symptoms. They will be dizzy. You understand? They might even pass out. Wow. You understand? Like when they get up from a sitting position, they will stagger, because their blood pressure drops suddenly. You get what I'm trying to say? So sorry, my kid just came in. Guys, please, 1 minute, please. So you get what I'm trying to say? Yeah, I want absolute number. It could just be this person has normal blood pressure. Because 90/60 is normal blood pressure. 100/60, 100/70, those are normal blood pressure. So it's not, I don't think they will send the person home and say, you have low pressure, go home. Because infection can be a cause of low blood pressure. Or the person may have taken medication that dropped their blood pressure. You get what I'm trying to say? So yeah, they should give me specific. I can't work with they said I have low blood pressure. I need to work with the number because blood pressure is a number game. You understand? It is not a symptoms game. It's a number game. And why you're playing with the number is because you don't want the number to cause complications down the road.
Okay. I think the same person. I was told to take a bottle of drinks. I don't know if that is okay, but that was.
Is it low blood pressure they told him, or he has low blood sugar?
That's what. Please, if you are there, you can resend it. Is it low blood pressure or low blood sugar? So that they will know the appropriate answer to this. Thank you. And while we're trying to round up, because we just have 8 minutes more, when it comes to business, okay, this person is asking, we've answered this piece. Can high blood pressure be eradicated finally? We've answered this piece. Okay, said low blood count.
Low blood count.
Yeah.
That's what they call anemia.
So they said he should drink minerals. So I can tell you, you go back to your hospital. No, but this question is too direct, please.
Yeah, the question is not
personal direct. It's a personal question.
Yeah.
So
maybe
what
the
we're
person
talking
did not
about,
even see a doctor.
They're treating a business-related health issues. Please, how we can help, how we can scale our business with normal health thing and all that. So I'm sorry, I might not be able to go deep into your question. Try to visit a hospital, give you a better understanding. We can't do things in abstract because we don't know. We need a lot of facts. And if we go into that, we might not finish this program for today. So please, that will not be answered. Sorry for. I know you are the first time to join this program, but our program we encourage people, we accommodate a lot of things, but we go with the topic. Well, and next month is another month that we're going to host another topic, so you understand better. So I'm sorry, we can't go into details with that. And the last question I'm going to ask I think you've been from back end, you've been popping up this question. After this question, please, no more question for today. Let us just have a blessed night. I know over there in Nigeria, you guys might be running late, but we still have more time down here. So the question I just need to pick from this. This is I want something. Okay, maybe I can take this because
we can take one more question.
all these questions. Okay, this one is saying, how can I encourage employee to be more dedicated to their work? To be more dedicated to their work, but most of them do lie about their health. How can I mitigate against this? Engineer, and I want doctor to give us his own view too.
I mean, you know, it's a Nigerian. There's Nigerian where people don't want to discuss their health, and it's understandable. People don't want to discuss. You can't ask people, "Do you have diabetes? Do you have blood pressure? Do you have?" No, you can't. It's confidential. People's health, it's a personal thing. You can encourage them, like I said earlier, give them opportunity where they could be confident to tell you that, okay, I'm going to see a doctor today and all those things. You know. Yeah, so those are things. Just give them the liberty and the freedom to know that they can seek permission from you and you're going to grant it to them to go see a doctor. Let me put it that way.
Yeah, like you said, that's just it. Sometimes we do circulate of papers, some info questionnaires. Sometimes most of the staff they don't even answer. They want to shy away by it. So you just need to manage them. You know, human being, they said the worst people to manage is human. Did you know you can manage dogs, animals, they will listen to you. Human beings that we talk, we see ourselves, it's very, very difficult to manage them. You just have to be diplomatic and use your sixth senses. Because sometimes you need to use your nose. That's why I said I relate with most of my staffs. We play a lot, but keep that there should be a boundary in everything you do. The more you get related to them, the more you should be able to know where they should cross the boundary, but let them be free. But their freeness does not mean, or freedom does not mean you let them go beyond the boundary. So, okay, the last question for the day while I round up. This one is just, okay, it's direct. They said, how can I stay ahead of my competition and stay innovative while involving with health-wide with the staffs? I think what you're asking is multiple questions. How can I stay ahead of my competition? I stay innovative in time with health with my staff.
I think it's a question for you.
I know that. You just been giving this health thing about it. Anyway, I'll tell you what you need to do to stay, to be ahead of the game. You yourself, you need to be multitasking. You need to go. I keep saying it, training. Training can never be overemphasized. You yourself, equip yourself, know more about the game. Always check and do feedbacks, send in questions, call your people, change your strategies. I tell people the strategy that you are using last year, if you see there is a downfall or there is a downfall or there is a downfall in your income, revenue, profit, and all that, I tell people don't stay on it too much. Try to treat it. Tweak that strategy and walk ahead. Most of us, the same strategy you've been using for 10 years, because it was working for you 10 years, don't you know that technology has gone beyond that now? AI is available. Most people are on now social media. If you want to be ahead of your game, social media, if you don't go on social media, now it's a global world. I'm in US now, I'm speaking with my audience in Nigeria. In the next few weeks, I'll be in Nigeria. I will still be relating with all my business over here in US, in UK, and everywhere. So what you need to do, work with the trend. I know what you're trying to explain. We had this thing yesterday too. Those people that missed the class of yesterday too. Yesterday was so true, something that you need to take on. I explained how you can gain more jobs. I'm into facility management. We are into cleaning. We have pest control. How have you been getting those clients? We explain it, but I won't explain it today. I will only tell you, do those things that is necessary for you to do. In the same time that we are all complaining the economic or the inflations and all that, do you know a lot of people are getting more jobs? That is life for us. And I mentioned something yesterday. Opportunity comes. We need to tap into it. If you're saying you want to be ahead of your game, do you know the present thing that is going in now? That is coming that a lot of people might be a millionaire, billionaire as we speak. This thing came in 2020 that most people didn't take advantage of it. Another one is around now. And I can tell you some people have started investing. Some people have started doing their own investigation, doing research. By the time they start picking, you will say, and you'll be there. And you guys are both into this cleaning business or post-construction business. I won't mention it because we did it yesterday, but we're still going to upload it later and all that. We're not uploading that because we did that class, it's for free class, but that thing is now the highs that most people are looking at. So to be ahead of your game, change your strategy, work about, tidy up your document. I mentioned it too yesterday. I will say that, okay, I can give you that. For you to get some jobs, you need to, now you know what is going on in Lagos and some part of the world. A lot of us, we don't even have tax. We don't have our tax ID. We don't pay tax. And there are some jobs now, they will ask you for, have you paid your tax? If you don't have your tax certificate, they will not give you some jobs. Now, most of us are not ready for that. Your book, is it tidy up? Have you tidy up your book? You said you want to get a job from a local government, state government, federal government. Oh, PCB is getting job from government. If you don't have the necessary document, they won't give you. Start now. You can only do a job. Sometimes you can do one job in 1 month. You are good to go. But not you taking some jobs that I feel bad, but we need to go back. We need to stop. The program is going to end, but I will just give you one thing. When people call me, doctor, please, engineer, I've not been working. You are into cleaning. You said, when they call me, I feel bad. I have to ask some of my colleagues, is that true? He said, engineer, for a whole month, he's doing only one job. And the job itself, when he mentioned the price of, he said, I just have to take it for someone to leave. When he told me the amount, I said, for a whole month, and you've been in this business for so years, there's something wrong somewhere. But I asked my colleague, they said it's possible. And I said, why is it possible? Because you are not doing what you're meant to do. A lot of us are running away from training for you to be equipped. You need to get what is going on in your business. Most of us are keeping friends. See, networking. Do you network? Doctor mentioned something. It's even good for the health. I've gained something today. You don't go to parties. You don't socialize. You stay inside your house. And you said you want business. It's not like it doesn't work like that. You are not in any WhatsApp group that you can see any new thing that is coming up. It's not going to work. Even the church that you go to, do you know that you socialize there too? You need to do some things for you to get something done. You can't be in your room and you expect miracle to happen. It will not. Move with people. Go to when they invite you to these things will not. So you need to help yourself. So at this point, I will need to drop my pen and I will need to sleep. I need to zip my mouth because we said a lot of things yesterday. So I don't need to repeat myself. So thank you for coming on board. Next month is going to be another month that we're going to have another PCB knowledge sharing. Where we're going to bring another facilitator on board, which we are going to get. It's a monthly program which we started. This is going to be the 39, I think it's 39 or 38 edition, and we keep doing it. It's a free edition, and I believe we just need to do something for the economy. We need to do something for the public. We need to do something for the community. This is the only way we can achieve something. A lot of us have gained today. I've learned some new things which I wrote down, and the people ask different questions. So let us see next month with another new topic, with another new facilitator. At this point, let us appreciate Mr. Yomi Ogundure because he has done justice to the topic and he has given us his time. Because I can tell you something, here in America, time is money, as they say. But for him to give us that time, please, let us do our normal culture as we do. Let us unmute ourselves and we drop our, okay.
Thank you, sir.
So let's thank him so that he can go and rest. We appreciate it. So let's unmute ourselves and appreciate our
Thank you so much.
Thank you very much for your
Thank
time.
you for having
we
me.
really
Thank you for
appreciate
having
you.
me. Thank you. All right. Thank you, Chief.
Good.
All right. All right. Bye. Thank you.
Recording